Hello everyone, it's Dr. Nikki, the board-certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. Happy holidays to everyone. In today's podcast episode, I will be talking about menopause and hormone replacement therapy. Let us get started. When a woman has reached menopause, the woman has had no periods for at least 12 months. So when your period stops and it has been at least 12 months, you are considered to have reached menopause. We do have some years before you reach menopause and during menopause, and we call those periods around menopause perimenopausal or perimenopause. So some people start having the symptoms of menopause way before they finally reach menopause. And even during menopause, they have symptoms. And we'll go over the symptoms. So where hormone replacement therapy comes into play is when the symptoms of menopause starts. Okay? We have hormone replacement therapy, which is HRT or ERT, estrogen replacement therapy. We talk about hormone replacement therapy when you start having these menopausal symptoms. And it's important that you discuss this option with your healthcare provider. All right, so menopause, as I said before, is a time in a woman's life, and it is a normal part of aging when your periods stop officially for at least 12 months. Okay? And during this time, before the menopause and during menopause, you would notice like fluctuation in your hormonal levels. You know, your hormone levels keep going up and down. It's not stable anymore. Some of the symptoms that you may also experience include vaginal dryness, pain during sex, night sweats, hot flashes, and some other things that you may experience when you are going through menopause. Okay? Some women, these symptoms are very mild and they may go away on their own. But other people, they have extreme, moderate to extreme or severe symptoms that need intervention. Some people, they take over-the-counter supplements to help with their symptoms, menopausal symptoms, and it works for them. Some people, they have to seek help through a healthcare professional to help them with, prescription medications that can help with these menopausal symptoms. So that's where HRT comes into play. So HRT, hormone replacement therapy, is also called menopausal hormone therapy. It can help to relieve some of the symptoms of menopause. And some people use HRT also to protect against osteoporosis, but that's not the topic for today. All right, so please remember that HRT is not for everyone. Not everybody going through menopause can get HRT. It is contraindicated for some people. You should not use HRT if you have liver disease, if you have history of blood clots, if you've had a stroke or heart attack, and if you have certain types of cancers. Of course, you should not use HRT also if you've had problems with vaginal bleeding or if you think that you're pregnant. Please discuss this with your healthcare provider. Okay? We do have different types of HRT. We have some that have only one hormone, which is the estrogen, and we have combined therapy, which is the estrogen and the progesterone. All right, so it depends. It depends on your situation. All right, so some people will say, does having maybe a uterus, which is your womb, make a difference in the type of hormone therapy that you should take? Yes, it does. Okay, yes, it does. If you no longer have a uterus, which is your womb, or like if you've had a hysterectomy, then you don't need to take progesterone. You only need to take estrogen. Okay, so it is important for you to discuss that also with your healthcare provider. If you still have your uterus, which is your womb, then you need to take progesterone along with the estrogen, and that's the combined therapy that I was talking about. All right, so it does matter, and you should discuss that with your doctor, healthcare provider as well. Okay, so as I said, there are different types of hormone replacement therapy, HRT. Some of them are in forms of vaginal creams, and I have a lot of patients that do use the vaginal creams for vaginal dryness, because that is a huge concern for some people undergoing menopause. Vaginal dryness, and then the hot flashes as well. All right, so we have vaginal creams, we have rings, we have gel, we have skin patches, and we have pills that you can take every day. But all these options you need to discuss with your healthcare provider to discuss your risks and benefits for you. Each person is different. Your friend might be on some type of HRT that is not good for you, or that is not appropriate for you, and vice versa. So please do not think that everybody can get the same type of hormone replacement therapy, or that it is suitable for everyone to have hormone replacement therapy when they're going through menopause or having menopausal symptoms. So please discuss your own risks and benefits with your healthcare provider. And I always tell people too, when you decide to take HRT, it is advisable to start with the lowest dose as possible and for the shortest time. All right, for the lowest dose and the shortest time. And also checking with your healthcare provider or your specialist to reevaluate the need to continue taking HRT every 3 to 6 months. Okay, you want to start with the lowest dose and go for the shortest time as possible. All right, so remember, not everyone qualifies for HRT, or it's not suitable for everyone to be on HRT when they're having menopausal symptoms. And we do have HRT that only has one hormone, estrogen, and we have the combined one, which is the estrogen and the progesterone. All that is combined. Okay, so please discuss your options with your healthcare provider and make the best informed decision for you, for your health. All right, well, I hope this helps, and I hope that you share this episode with friends and family. Remember, as I mentioned before, some people do not need HRT. Their symptoms are very mild. They may go away on their own. Some people can just take supplements, and it helps them, like black cohosh, and it helps. Some people need maybe prescription from their primary care provider, and it helps. But some people do use the hormone replacement therapy, and as I said before, I've seen a lot of people with vaginal dryness that just use the vaginal creams, the estrogen creams that help them with the vaginal dryness. All right, well, thank you so much. I hope you enjoyed this episode. Share, and I'll catch you in the next one. Take care. Bye-bye.